say
Makes
what you're
sense.
saying. It seems like a simple thing. Monitor your
Yeah.
blood pressure, but
Yes.
there's so much buried underneath
Yes.
workflow and the needs and the nuances of like when you enroll them and the things you say and right like it's much more complicated than it appears on the surface. Very easy to say, just wave
It
your hand and
is.
say, we're going to start a program and not really have a plan.
I think that's a very well thought out. I think because like, people are like, oh, remote blood pressure monitoring. We have someone in the hospital 24/7. They can just do it and it'll be so easy. But the issue is not the algorithm. The blood pressure algorithm, like I said, is
Right.
evidence-based. It's already done. The issue is operationalizing it within your own healthcare system. And that is something that takes dozens, if not hundreds of meetings and figuring out your own needs. And that's where it can come in and basically take that off your plate by making it possible that all you need to do is contact us because we've already figured out how to do the surveillance, who's monitoring, when we need medicines, what medicines to give, in people that speak whatever language that they speak. It's a much more cost-effective program to implement. And again, the feedback that we're getting is so positive because of the feedback loop that happens automatically from the text message, but also we check in with all of our patients at least once a week as part of our collaborative care. So they really feel seen. The automation allows us to scale probably 4 or 5 times. We are currently actively managing about 150 patients because that's about the volume that we have at our hospital for those first 6 weeks. And that was a completely overwhelming volume for the program before. And that's why they had to hire another person because patients were falling through the cracks, because it was hard to remember when people weren't sending in blood pressures. And the automation makes it so easy for us to not only keep track of everyone, but to make sure everyone's doing what they need to be doing to stay healthy.
Yeah. It's almost like New York Spheres or
Yeah, anything. Yeah, yeah.
California says what
Yeah.
whatever state we're in, the program is an automated assistant or like a buddy to
Yes.
make all of it possible.
Yes. It's a seamless adjunct to the care that is already being provided.
It's so interesting because you don't think about gaps in care as used and overused and abused as a term, but like in this case, until you break down like the traditional flow of the patient through the system, you don't realize that there are these big gaps. And in those gaps is actually where you've identified the opportunity to save their life, to prevent long-term chronic disease. And so much happens and doesn't happen. So much can happen, but just doesn't. It's
Yes.
a big,
Yep.
there's it's like the Grand Canyon without a bridge, or use whatever metaphor you want, but there isn't a bridge. We're providing it.
Yes. That's exactly how I've conceived or interpreted what the potential of this program is. It's a bridge from the world of pregnancy and delivery into kind of the lifelong world of preventive care for people who are at quite high risk of serious complications.